What are some things that people don't know they can ask their therapist? Because sometimes people don't know they can ask their therapist questions.
That's true. I would always start with, what's your diagnosis? That's an important one, I think, for everybody. It's a little bit like, it's like identifying the beast, know thy enemy, you know? So like, what's my diagnosis? It could open you up to like some different treatment modalities that would work for you, or, you know, give you an ability to find like online support, seeing if that's something that feels like it fits for you. What are those things that you would recommend for me that would be good aftercare plans?
So like personalized beyond just you should get a therapist when you're done with this program.
Yeah.
Get a psychiatrist. For me specifically, what should I do?
Exactly. Okay. Yeah. Aftercare planning isn't just therapist, psychiatrist. It's like, how do we gain healthy supports?
Are you allowed to ask therapists questions about their personal life?
No.
No?
Nope.
Never?
I think some things could be appropriate.
I kind of think like you can ask. That doesn't mean they're going to answer.
Exactly.
Maybe there's times to connect where there's some way you can build a rapport, or you can connect with your patient by like having some common ground, but there's definitely like a line.
There's definitely a line, you know, things like, you know, do you have pets? Because personally, I know there are pictures of my dogs everywhere. And that's a cool point of connection. But like when it comes down to like, hey, like, what's your relationship like? You know, the answer is no. We're not going to share that. You know, therapists are people too, but you know, we shouldn't be diving all the way into it because that takes the focus off of you. Right.
It's your therapist's job to have those boundaries. So like if you're on the fence about asking something, you probably can ask, and they should be able to say like, hey, you know, that's not appropriate. Or like, hey, I'm not going to answer that, and here's why. Right. Or maybe they get curious about why you're curious about that. That could be a really good discussion topic in therapy. Yeah, definitely. Do you notice improvement in me? Okay. So I feel like that's an important one, because it can be a little bit like, you know, well, I still feel this way, or, you know, I'm not having a good time at home. I get home and everything still feels bad. It feels awful. One of the things that's also beneficial about group therapy is you've got different people who are able to gauge how you're doing, how you're presenting. Feelings aren't facts. Sometimes we can feel really bad, but, you know, people might notice things like, you're laughing now. You didn't laugh 2 weeks before. Or, you know, you might want that outside perspective, because if it's you every day and it's your brain trying to assess how your brain is doing, you know, sometimes you don't know. And the therapist might forget too to let you know, hey, wow, this is the progress you're making. So things like having specific goals or having measurable outcomes, like doing assessments. I find that to be helpful with people. I always enjoy a discharge showing someone like, hey, here's what your graph looks like, and look, you were there and now you're here. And it's always cool to see, like, it's surprising to some people. Sometimes we don't have that awareness, and we're also our most harsh critic. A big one that I feel like is important is it the right time to work on my trauma? Some things that are kind of important for trauma work are like reduction of SI, ability to cope, being able to name some coping skills that you go to, because trauma work is hard. Name them and do them. And those stabilizing things are the important things that are going to carry you through the trauma work, because if you're not able to self-regulate, then we're doing more harm than good, and that's not what we intend to do at all. I think kind of a takeaway might be, you know, if you're getting treatment, if you're in group therapy, if you're in individual therapy, you got to think of it like your healthcare. Like, you got to advocate for yourself, ask the questions, speak up, because a lot of people are afraid to, I think, and they don't know they're allowed to ask questions in therapy. Definitely. You know?